Hello, sir. My name is Nurse Hyman. I'm a student with Vincennes University. I'm going to be doing your catheter today, okay? All right, so we're going to get started by donning on some clean gloves, taking care of his hygiene here with the Foley kits provided by the organization you work at. You're going to take those gloves off, throw them in the biohazard bag. I'm going to get started here with sterile 1-inch borders, opening our packaging. I'm going to pinch. I'm going to set it up over here. I'm going to pinch the gloves and toss the packaging, making sure my sterile field is in view. I'm going to open up our gloves here, 1-inch borders. I'm going to start with the non-dominant hand by pinching. Not messing with it. I'm going to scoop the other glove and not mess with it. I'm going to next pinch this drape. The glossy side goes down towards the bed. Leave it underneath the patient. Pinch the drape. It's going to cover my workspace. Next, I'm going to readjust my kit, staying within the 1-inch border. I'm going to start by opening my cleaning swabs. Next, going to clean meatus, starting in a clockwise position from front towards the tip, towards the end of the head. I am then going to prepare my lube for the catheter, taking off this cap. Next, I'm going to insert my sterile water into my catheter port to be able to inflate the balloon. Going to first get rid of this air inside the syringe. Next, going to take out the catheter portion from the covering, making sure I don't break sterility. Next, I'm going to prepare the catheter and the lubrication. I'm going to record pain tolerance of the patient, how he took the catheter, the French, and how much fluid I inserted into the balloon. Next, I'm going to tell the patient to relax. I'm going to commit one hand while I begin. For males, I'd go 5 to 7 inches to the bladder, and then 1 to 2 inches after. On this particular doll, you can't go too far or else the balloon won't insert. We'll then inflate the balloon, recording how much fluid I inflated into the balloon. Once you hit resistance, you know that's max. I will then unattach this from the port. We'll give a slight tug to make sure it's in there. Take my catheter, attach it to the patient's leg using a stat lock, and attach the bag on an immovable part of the bed. And I'm going to remove it. Before I remove it, I will, of course, tear down my workstation. Be mindful of the patient and the catheter. And when I come to take it out, I'm going to use a new syringe, getting the amount from the nurse before me in the chart. Going to clean the port with an alcohol wipe. I will do this twice just to make sure I have it all. Then I will tell them to take a deep breath and exhale, and I will pull it right out.